Hello, welcome back to Apple Worldwide. Guys, I miss you guys so much. Thank you so very much for all the new people that have joined the platform. I so appreciate everybody. So, guys, I want to talk to you guys right now about anxiety. It's something that is on the rise, just like ADHD and other things that we see in the community, and most especially in our children. Okay, anxiety has come about, I think, a lot, I guess, because of the pandemic and everything going on, lack of activities in the community for the parents to sign their kids up for a lot of factors, guys. Diet, a lot of things. And when somebody have anxiety too, I want to first start off with saying that take the child to their pediatrician. Let them rule out if they have any low blood sugar can be a contributing factor to their tremors or anxiety or irritability, maybe their thyroid function, a lot of things like that. Diet, all those things can be affecting their emotions and their ability to feel nervous or be able to control their anxiety. So if what we talk about anxiety, what at all is anxiety? Anxiety is a normal stress response to every human being has. It's a normal phenomenon whereby you have something coming up, or I have an exams coming up, I'm super nervous about it. I went through that, guys, when I was taking my ANCC exams. My friends would tell, oh my god, it was that bad. Okay, it was bad because if you follow me when I started my Upper White journey, I did talk about the fact that after my divorce and then parental alienation and going through family law court, I went through a lot, and I went back to do my RN right after my separation and divorce whilst I had 11-year-old and a 3 years old. So it affected my ability to process information and finish exams on time. So when I took my first pediatric exams, PITS, in the PITS class, I had like 66%, 66 questions right out of 100. But the twist to that is I did not finish the entire 100 questions in 2 hours. So I finished like 78 and I had 66. Well, that's not bad, right? Yes. If I were to finish the exams, 100 questions, I probably would have passed, but that wasn't the case. So I had to withdraw, went through a process where I talked to my school counselor in the college, and then I was given extra time for testing. So I think that thing was echoing back in my mind, like, oh, when I took certain exams, I didn't need that accommodation. What do I do? So that stress, that fear, and ever since I have had test anxiety, super bad test anxiety. So when it's that bad, that is you are unable to control it, that is when you need to seek help. So when a child is going through these things, first of all, go to the pediatrician. Make sure they rule out any somatic condition that is affecting the child before you think of consulting with a psychiatrist, a psych nurse practitioner like myself. Yes. So what is that? We're talking about anxiety, right? It's the flight and fight response that we have in the part of our brain called amygdala. As a result, when you perceive stressful events, either something in the past, like somebody that went through trauma, maybe the person has been raped by somebody, so anytime they see somebody in that category or that looks like that person, then they perceive threat, so they become anxious about it. They have some symptoms like sweating, hyperventilation, chest tightening of the muscles, stressful abdominal pain, headaches, irritability, muscle tension, poor ability to concentrate, right? Today with the kids, the same. They're going through that. When you have a child that is, especially that teenage group where they have hormonal changes, they have a lot of anxiety with school work. We have some of the kids that, like I have a child that is in 7th grade but also takes a GT class. And the workload in those classes are very high because a GT student takes 2 class level higher than their normal class. So if the child is in like 5th grade and they are a GT student, it means they are going to be taking 7th graders coursework, so all that can be a stressor to them. When they have exams coming up, they are anxious, thinking about how do I do this. So this stressful event or They are working in the community. They see a dog, a child. I have one of my kids don't like dogs. So when they were growing up, if they see dogs, oh mom, he runs to you. That's a normal stress response, no perception of their fearful object. But one thing is that it is characterized by worrying so much that you cannot control it. Okay, so when the worrying of these stressful events is constant, they can't control it. It's becoming something that impairs their day-to-day living. It affects their relationship with the family. It affects their relationship with their school. It affects their ability to concentrate, stay focused, and catch up with their schoolwork when it's required. They have a lot of irritability and anger issues, and most importantly, if they don't, and they can manipulate too. When they have these symptoms, also as a parent, be careful whereby you are able assess your ability to provide support in the way that they don't get away with things by manipulating you with those feelings. That is another issue. So as a parent, try to observe, assess, and if the need is there, seek counsel. The best practice for treating anxiety is CBT, cognitive behavior therapy. But here goes the thing: if the cognitive behavior therapy is unable to help, then you go to see a specialist who have a prescription authority and can prescribe for the child. Like me, I'm a psychiatric nurse practitioner, so I can do the CBTs, but most heavy part of my job is the medication management. So what does the cognitive behavior therapy does, CBT does? It helps the child to cope. If there's a perceived situation, they are going to work on coping strategies. What is the fearful object, or what is the fearful or the situations that are stressing you, that makes you worry so much, that makes you not to be able to control this worry? Okay, how do we brainstorm? How do we problem solve? How do you approach the situation in the way that you can cope with it and not have it stress you up? See, so if it's an exams and you are scared of the exams, guess what? You start preparing for the exams way before it's due. So by the time the exams is here, you are super confident and super relaxed and able to sit and take the exams. And when you sit down there, I remember those days, as I described in my situation, I would take water. I would sit in there. When they gave me extra time, the anxiety was still super severe. I've never been on any medication for it, but at that time I would sit down, and then in the exam center, I don't take the exams at that time with the general group, because the group would take 2 hours. I need extra. So when I go to the test center, they would not even let me sit with a bottle of water. So in between, and I had plenty time, so I could get up and go and drink water up front where the supervisors were sitting to oversee us taking the exams. So I would go there, sip a little bit water, stretch up, and then come back and sit down. So these are some of the strategies or things you can learn in. And honestly, I never knew about all these things, but I just have this high threshold in dealing with situations. I guess when you've been through so much in life, you're able to cope. You have a high tolerance. My tolerance level was high. I was able to develop my own coping strategies and stuff that helped me. But now, knowing better, being through nurse practitioner school, knowing all these things were really things that are learned. They are skills, they are coping strategies that are learned. Guess what? I realized it was helpful when I did them. So these are things that can be helpful. You don't pat the child. Oh, it's okay. Oh, I'm sorry you're feeling this way. Yes, you are sorry. But most important in any situation is arming the person going through the situation with tools, strategies, coping mechanisms that they can deal with the situation. But because when you deal with the situation, you know how to approach the situation, you know how to problem solve. Most important thing in any situation, learn to problem solve. When you arm the child in problem solving, they will be able to see, oh yes, that's the dog coming. Yeah, I always get scared when I see a dog, but guess what? I'm not scared. I'm going to stand right here and just fix myself up here in this corner, and I'm going to watch, and the dog will come and pass away. And as soon as they pass away, then I'm going to proceed. I'm going to stay right here in this corner. I'm getting myself eliminated from the path the walkway where the dog is coming out, or where the lion is coming out, or whatever the object, the stimulant is, till it's gone, and then I will move. But guess what? If it's in the house, then everybody has to engage in maybe family therapy, whatever, to help with coping, help with problem solving. It takes a village. Everybody involved need to be involved in solving this, okay? Or recover, to have the worrying, the persistent worrying, the anxiety, the panic attacks, the difficulty breathing situations. They can't sleep. If it's affecting their sleep, their behavior, their inability to complete tasks, stay focused, do assignments and stuff, that is when you will need to consider treatment with a different measure, which involves using SSRIs or SNRIs. These are the two main medication groups that you can use. So somebody asks, what medication can I use in treating my child's anxiety? These are the two groups of medication. But I need to tell you something. With these medications, it's not like, oh, I have headache and I took Tylenol and boom, it's gone. No, it doesn't work that way. You have to understand it takes a while for them to be effective. How long? Most of the time with the SSRIs, it takes like 2 weeks to 4 weeks ish. And that is evidently seen in at least 50% of this group of medications. But with the SNRIs, sometimes you're looking at 8 to 12 weeks. So when the child is taking these medications, you need to give it time to work. When the child comes back and says, Mom, I'm taking this medication, or Dad, I'm taking this medication, it's still not working for me. Give it time. It does not just work magic and then that's it. No, that's not the issue. It doesn't go that way. It takes time. So knowing that it takes time is very important, okay, to start with. Secondly, also, these medications can have some side effects. Sometimes the headaches that comes with the anxiety can also be seen in the side effects of this medication. Why? Because these medications can cause a lot of drowsiness, and meaning that they go to school during the day, they are drowsy during the classroom, and that will also affect their functioning. It can also affect sleep, insomnia. So because they are not sleeping well at night because of this medication, when they go to school, they are now tired, they are being forced to stay awake, and guess what? It may be hard. And in some instances too, you will see suicidal ideation. When you start anybody on any of these medications, you expect that in some rare instances, you have some patients that have the side effects of suicidal ideation that comes with this medication. But now, what do? As a provider like me, sometimes, it's like when it comes to psych, everybody have their approach, okay? There is a gold standard, but then out of that gold standard, like, okay, I'm treating this patient with SSRI. Somebody will also treat with different kind of SSRI, because we have different medications that fall under the SSRI. You understand? So, like example, when I have a patient with ADHD, I don't like giving them medication towards the end of the day. I want them to function during the day. If they have issues whereby around noon, let's say they took their medication in the morning, and around noon to 2 p.m. they are complaining that they are beginning to lose focus, they feel like they are inattentive at that time, I will give them some breakthrough medication around that time. But I don't like to give them medication towards 4 p.m., 3 p.m., 4 p.m. Then it's going to get time for them to go to bed, and then the stimulant will keep them active and awake, and they can't go to bed, so they will lack sleep. And then they have to be up in the morning, and everybody in the world, including myself, their parents, the school teachers, expect a child to be awake and alert and oriented. Hello? So personally, the approach I take is I don't give them medication towards the end of the day. I prescribe it for earlier parts of the day, so where they need it to stay functional, to be more active and more responsive and more concentrated and more focused. That's how I approach my treatment strategy. Okay, so that being said, I want to tell you the neurotransmitters that are in the brain, in the amygdala part of the brain, that affects you or anybody that goes through anxiety. We have this neurotransmitter norepinephrine. It is the flight and fight response. It gives that response. Then soon as you perceive stress, soon as you perceive a threat, soon as you worrying so much, it increases the norepinephrine in your brain and keeps you active and stressed up, and then it gives you that response. Another neurotransmitter that also affects your anxiety is, guess what it is? Put it in the comment section. All right, put it in the comment section, but no, I'm gonna add to it. Serotonin and corticotropin releasing hormone system in your brain also releases more cortisol. It releases more cortisol. This same neurotransmitter also, when somebody have infection, it also releases a lot of cortisol in your system. So this is why when somebody is going through these situations, I suggest you see, especially children, you see a medical provider first, your GP, your pediatrician. Let them do some lab tests. Let them rule out you don't have thyroid hormone situation like that, issue. You don't have infectious diseases developing, or you don't have low blood sugar like diabetics and stuff like that. Then we move on to, okay, now that you don't have this, so you have to rule these things out. Then now you have to consider moving forward with seeking the next level of care, specialists in the mental health or psychiatric mental health category. Okay, since this is becoming, and it's going past 6 months, 3 months to 6 months, and this is affecting your day-to-day life, it's affecting your ability to function, do normal things that you would normally do without these stresses, without worrying so much. That is when you know, I've done everything, it's not working. I've done my deep breathing exercises, I've done my relaxation therapies, I've done my mindfulness therapy, I've done my, you name it, meditation. None is working. All right, now it's time to see somebody for a little bit medication, because medication has proven to be very effective in managing their symptoms. Yep, so that is why I came your way this afternoon or evening or morning, wherever you're watching from, your time zone. Yes, so if you are here, don't forget to like, share, and subscribe to my channel. I appreciate you stopping by, and I love you so much. Don't forget to like, subscribe, and leave me a message. I would love to read from you. I appreciate you so much. See you